So these are CAPRS. So they look kind of like alien helmets, but it's not all assembled. Inside of here is a filter. So we change them. Manufacturers told us to change them once a year when they become visibly soiled. So we do change them out once a year. You don't have to worry about that. We have to maintain them monthly. We do checks on them. So we have 2 of them located here. They're currently in lab just for plug-in purposes, but we'll look for a better place for them. So some components about this. So I'm gonna go over the different components that are here, talk about this. We'll assemble it together. I'll show you how to don it, doff it, and then how to clean it. Sound like a plan? Okay. So first off, we have these very nice small things that are gonna go inside the capper, okay? Some people say, well, do I have to wear it? Yes, you should put them in there. This is Velcro. It hurts if it's scratching your head. Aside from that, for cleaning reasons, if you sweat or anything like that, have makeup on. So these do become one per, like you can have one like each and save these as you do your shield. Manufacturer recommendation is that you change these either once per shift if you're actively using them, or if you don't use it routinely, once per week. So just something to know of when to change these. These, they say, can go a little bit longer once they're visibly soiled, makeup, that kind of stuff. We usually just rule of thumb once a week, change them out. So this little piece is gonna go in the back. It is like styrofoam, so it does just Velcro right in there. Front piece is gonna go on the sides. There is 3 pieces of Velcro, so make sure you cover all 3 of them. If you have long hair, it does get caught in there if you don't get it right. So as someone that's had that happen, just make sure to double check that. So that's essentially how it's assembled here. The next piece we have is the charger pack. So this is actually what's going to make your air flow from here. Things to know, the minute that you plug this in, it's gonna start making the noise as if it's running. That's completely normal. When you unplug it, you'll push this black piece. This black piece is only to disengage it. So you don't have to push the button to make it go or anything like that. You just slide it right in. And then to take it out, hit the black button. You can pull it out without doing the black button. Please don't do that because it'll break this little black button piece, and then this falls out while you're walking and trying to keep proper PPE on. The next thing we have is the shield. We're gonna go over this, but when it comes out of the box, it's going to have it's gonna have one cover here, and it's gonna look like it has a second cover. So you will peel this, where it says peel here. This is the only thing that I know that actually has the nice peel sticker. You'll peel right off. I will show you how to use that. You do not wear a mask once you put this on. So you do take your mask off to don when you're putting this on, and then put your mask back on afterwards. So no N95 or no surgical mask while you have this on. Part of the reason being, you're getting airflow, so you don't want those germs and particulars that are on your mask to be put into here. Some things to know about the capper itself. So it has a filtration system right here, so it's filtering the air, and that's where that filter that's inside of here comes into play. It also has, if you look right here, it has a button, so you can actually change the size. So if you've got a hair bun in, that kind of stuff, and you need it to be up a little higher or lower, you can actually pop these and move the buttons, so you can pop them on both sides and move them to where you need them, and then just push them back in. They are a little finicky if you don't do it very often because the holes aren't very big as you're doing it, so something just to know. So other things. This filtration system is extremely nice because, don't drop it. I mean, it works if you drop it, but. So this filtration, it's going to tell you red, green, yellow, just like a stoplight, okay? So you're gonna look for these lights either before you put it on or as soon as you put it on, you can look up and see the lights. Green means good, it means you're gonna have the airflow, it has a sufficient battery in order for you to be in for an extended time. Yellow means you don't have near as much battery. You need to probably look at getting that changed, usually about 10 to 15 minutes. It will last longer than that when the yellow light is on, but I always tell people you don't necessarily know if it's ready to go. Because we plug this in between every use, it should always be green for you unless you've been using it a lot throughout the day. Red means battery's dead. If you're currently wearing it and it goes to red, you need to walk out of the room because your airflow is about to stop. Now, it doesn't mean that you're cut off from all air, but it does mean you need to get it off because it goes really stale in terms of the air. There's no circulation and filtering it. So, next things, on the back here, and here, is a thing that tells you your fan speed. So you can actually control your fan speed. You can make it go really fast, really slow, or somewhere in between. It's defaulted to 2 because that's usually the airflow that's kind of recommended in the settings. So you can change that as you would like. When you put this on, you're gonna wanna make sure, I'm gonna put this on actually without the shield so we can talk about it first. It gets a little stagnant when I'm trying. When you're putting it on, you're essentially gonna put it on front to back, and you're gonna tighten. A big thing to know about this is that you want this to sit at the base of your skull. So where your hump of your skull is, you're wanting this to sit underneath of that. So if you have a ponytail, you got a high bun, you got a low bun, you gotta move your bun so it's in between. So that's probably one of the biggest things. And when you take off, you're gonna rock it forward. Same thing once you actually have this on. I'm gonna show you how to put the shield on in just a second. This is the charger for it. So the battery pack plugs into the wall through this cord, and then it just plugs in here and it will charge it as it goes. There's no lights on the battery pack, so you don't actually know if it's plugged in, so just make sure you're pushing it in all the way.
Is that the same place that the helmet plugs in?
It's the same exact place, yep.
Okay.
So again, this talks about the lights too, if there's ever any questions. The battery pack does just images, but this will actually show you. So yellow, it's a constant current, but if the yellow is flashing, constant voltage. Green is ready. Green flashing means there's no battery yet. So when you first plug this in, you'll get the green flashing until it syncs up, and then red is no battery. And red flashing is there is an error going on and it's not triggering. Usually the battery is dead. On the front of this is where your shield is going to go. So like I said, the shield has the front part that you peel off, but on the back part, this is the part that's actually gonna go towards you. I'm gonna take my mask off now just so I can show you. So this piece, and I always find it's helpful to start at the top here, will actually come out, and that's what's gonna fold around you. So makes more sense once it's on and you peel, and I'll show you what that looks like. So when you're putting it on, you're gonna put it on starting with the middle one, and then you'll turn it so it plates it. Maybe, there we go. So then on the sides, you're gonna have some. Now, the holes don't always 100% line up, so you might have to kind of pull a little bit. You don't wanna pull until you rip it, but you can get it to like, just like this one here. As you notice, you can pull it taut. Again, sometimes you kind of have to make sure you're holding on to your capper, but it'll lock it in. If you're claustrophobic, you can plug it in before you put it on your head. If you're not, you can do it either way you prefer. I am claustrophobic, so I like to plug it in before I do it. I like to have that airflow on my face. So what you're gonna do is you're gonna, again, rock forward, put it on, and then inside here, it's kind of hard to see, but inside here, you're gonna peel away, and then you're gonna make sure, get my hair out of the way so you can see, that you're sealed as much as possible. Now your airflow is going out, it's not bringing it back in, so that's part of the reason of making sure before you go in the room, your battery pack is on and ready to go. But you're gonna seal it around your face, make sure your ears stay out. So that's a big thing. It will rip if you try to pull it back further. This plugs in, if you are wearing PPE like an isolation gown, you can actually tie your isolation gown and then actually hook this to that. Or you can plug it before you don on and don off. It makes it a little easier. I like to clip it to my scrubs. That's where I prefer. Now, when you're ready to come out of the room and you're getting ready to doff it, you're gonna go ahead and doff off your isolation gown and everything first. I also then hand sanitize before I take this off, even though technically this is still dirty, I'm gonna hand sanitize twice, essentially. So I'm gonna take this off, and then you're gonna unclip, lean it forward, set it down, and then this is where I unplug before I take care of actually cleaning it. Hand sanitize again, and put my gloves on to clean. So when you clean this, sorry, I wiped this down earlier, so I have one glove, but you'll wear 2 gloves. You're gonna take purple PDI wipes. So make sure it's not the last PDI wipe in there. You don't wanna like saturate this. This is obviously electronic. But what you're gonna do is you're gonna take it, okay. So I usually wash my battery pack first. That's just what. So you can wipe over that, but just don't wipe in it. Again, that's where we're trying to make sure it's not saturated. And I just kind of go down from bottom to top with this. You are gonna wipe the shield down with your PDI. Most of my staff do both the inside, not the inside where the staff is, but as you'll see, when you wipe down with the PDI, now you have kind of that bumps. That's why if you are using it a lot, you want to make sure to replace it. So these come in large boxes. We can get more of them, so we don't have a shortage right now. So if you want to change them, make sure you're changing them. We go ahead and take that off. Unclick. The middle one should always be the last one, just because if you don't, that one tends to rip off. And then you're gonna make sure, even in this styrofoam area, or it looks like styrofoam, and then you'll also clean the inside too, all the way down. And then 2 minutes in between, so it needs to dry completely. Then these should stay with your bag. So to store those, they need to be in one of the brown grocery sack bags. That should be how you store them. Let's get that out of the way. These CAPRS are stored in a box so that they're not rolling around and everything. Some things to know: if it drops, like again, this does have an electronic component to it. So definitely make sure when you're checking every time if the lights are flashing or anything like that. We definitely want to heed the warnings of whatever the lights are saying. The other thing is, in each of these boxes is also the inserts about the assembly of it. So this is clear from the time that you're going to put the foam on it or the filter on it. This will give you instructions with that. The other portion in Biomed, looks like this one doesn't, we have a lot of people that have already used these, but in Biomed we have a full, complete how to don, doffed, if you have a flashing light, what it means. Again, the battery packs, this is a nice feature that they started doing. Our earlier CAPRS that we got didn't have this, but these battery packs actually give you those lights, so they're really nice. So, do we have questions?